Hello, my name is Kai Landry, and I'm going to be talking about Walk Some Words, which is an evidence-based community health program designed to help lower cholesterol levels in Gulfton, Houston. So a bit about Gulfton, it's one of the most densely populated communities in Houston. The majority of this population are Hispanic adults. Very little of them speak English. So the effective language barriers on seeking and receiving healthcare are going to make this Gulfton population specifically very susceptible to preventable health conditions such as high cholesterol. As you can see, the median household income is below the poverty line, making people more subject to working long hours at minimum wage jobs, so they may have less time and money to dedicate to their health. 34% of residents have high cholesterol, which is what we're targeting to reduce, and almost half of this population is sedentary. A Rice University research article actually revealed that there might be probable cause for this, as there are very few sidewalks or any spaces for safe activity in Gulfton. So with my fishbone diagram, some of our key categories is policy and government, which includes any type of laws and regulations, environment and infrastructure, so our built environment and any of our surroundings that impact our outcomes, individual health behaviors, so any type of decisions or thoughts that an individual will make about their health, on top of social and cultural factors. So this has to do with our belief systems, our relationships, and then economic factors, which is our funding and personal expenses. Feel free to read through as you please. I'm going to be touching on some key causes and risk factors. So the two that I want to be focusing on today are sedentary lifestyle as well as language barriers. As far as sedentary lifestyle goes, this is mostly due to environmental factors such as lack of sidewalks, high crime, a lack of public parks. There are also some individual behaviors such as lack of motivation or knowledge about the importance of exercise, and then some social and cultural factors such as maybe work or lack of time due to childcare. And then for language barriers, people may be hesitant to seek medical care due to distrust, bad past experiences, fear, and then if they do seek care, they may not really understand their diagnosis or the treatment that's being proposed to them. The persona I've curated for Gulfton is named Mateo. He is a Hispanic 23-year-old male living in an apartment with his mother and two younger siblings. When he's not working, Mateo serves as a caregiver for his two younger siblings, and after a recent doctor's appointment due to shortness of breath, Mateo was diagnosed with high cholesterol. It's also important to note that because of the lack of sidewalks in Gulfton, Mateo primarily transports his siblings to and from school, as well as gets himself to and from work by driving or carpooling. This is Mateo's empathy map, things that he may say, think, feel, or do after receiving his high cholesterol diagnosis. So he may say, I try to walk, but there are not many sidewalks. I want to exercise more, but I don't have time. So a lot of what he's saying, he's expressing the lack of opportunity to exercise rather than a lack of desire. What he may be thinking, I can't miss work for appointments, my mother and my siblings are more important, so his priorities here are going to be centered a lot more towards his family rather than his own personal health. He might feel embarrassed, worried, afraid, frustrated, exhausted. As I mentioned before, he is 23, so he might feel a lot of shame towards his diagnosis. So what he does, because of what he's feeling and thinking, he might try to hide it. He might try to walk when carpooling isn't an option, but of course this isn't a very accessible option for him, and he may just try to skip appointments and put the diagnosis out of his mind. So the community being served here is the Gulfton community. It is a Hispanic population, ages 18 to 64, dealing with high cholesterol and language barriers due to sedentary lifestyle and linguistic isolation. My proposed solution is Walk Some Words. So this is our community-based intervention that's going to be aimed to reduce cholesterol levels. It's going to go about this in two ways. The first one is by increasing opportunities for activity, which is the walks portion, and decreasing the language gap in a medical setting, which is the word portion. So our mission is to reduce cholesterol levels through the implementation of physical activity centers such as parks and other recreational facilities, as well as increasing translation services, which will provide greater access to medical care. Some of our objectives, we want to increase physical activity levels by 15%, decrease or increase the desire to be physically active, and increase accessibility to healthcare services by 5%, all by December of 2031. So a bit about how Walk Some Words actually works. So our goal here is to reduce the cholesterol levels, but it wants to tackle these challenges in a way that is realistic and accessible to residents of Gulfton communities specifically. So the first component of this, implementing accessible walks and trails. So what is implemented and where this is implemented is going to be very need-based. So a lot of this program is going to be dependent on community members volunteering to give their input on what they feel they need and what they would feel most interested in utilizing. And then the second component of Walk Some Words is the words portion, which involves raising pay for bilingual staff. So we're going to do this through partnerships with local healthcare and resource facilities, and we're going to make sure these are implemented through formal conferences, data collection, and discussions, and then as well as helping fund these changes. This is my logic model, so sort of a roadmap of what we put in and what we expect to get out. So a lot of what we're going to be putting in is funding, administrative staff, materials, so construction materials, as well as information packets, guidelines, land to build on. When I say guidelines and posters, I don't just mean in English, I mean translated posters that are more accessible to everyone. And then, of course, our partnerships play a very big role in this between our staff and local healthcare facilities. And then, of course, a lot of time will be put into this. Our objective goals were to meet by 2031. For activities, holding meetings are very important because this is going to be between Walks and Words staff and themselves to track progress and logistics, as well as between volunteers and other community members, as well as between partner organizations. So a lot of meetings, communication and planning are involved, planning and budgeting. So planning for construction materials, planning for when the program will actually be implemented, how it's being implemented, acquiring resources. So these might be things such as city ordinance agreements, boosting incentives for bilingual staff, just to, create a environment where we can kind of bridge that language gap. So outputs expected are an increased number of community members engaged through our meetings and through utilizing our resource. This also creates a solidified schedule, so it lets people know when these resources will be accessible to them. Increasing residents who utilize resources is another output. In terms of short-term outcomes, people might feel more empowered and involved in charge of their health. They might initially, utilize more spaces. They might engage in more physical activity more often. Some intermediate outcomes, they may have more of a desire to be physically active since it's accessible to them. They are less susceptible to a sedentary lifestyle because of that. And then they might feel more assured and comfortable receiving medical care, which will cause more people to receive medical care. In terms of our long-term outcomes, of course, our main aim here is to reduce high cholesterol levels. And then we also want to see an increase in active lifestyles and a decrease in related diseases such as heart disease and stroke due to high cholesterol. We want to see more people taking charge of their health and an increase in utilization of healthcare resources due to a lack of language barriers. This is Mateo's journey map. So what brought him awareness was his initial doctor's visit because of shortness of breath. He might feel worried and concerned about his responsibilities shortly after he becomes aware of his diagnosis. Quick solutions and things that are realistic and accessible to him are going to be what keeps him seeking resources. When he first receives resources, he might get a new wave of excitement and motivation. Maybe the Walks and Words pamphlet helps him utilize his resources better. He learns about new parks that will be opening in his area, and then breaking barriers. So maybe he's trying out the new parks with his siblings during his daily routine. Maybe after school, on certain weekdays, he's taking his younger siblings to these parks and engaging in physical activity with them. Some barriers that Mateo may face during his journey is maybe developing new routines and seeing what works for him and what doesn't. I would say that the solution for this is just trial and error and seeing what is accessible to him in his everyday life, what solution is simplest and easiest for him to implement as part of a routine. So he's recognizing his barriers and setting realistic goals for himself. So maybe he's saying, okay, my goal is that we're going to engage in this much physical activity on these weekdays, and then spreading awareness. So maybe informing his mom about Walks and Words and about the community meetings being held and the fact that there are more translation service at their local healthcare clinics. So maybe his mother, who also struggles with language barriers, can receive care. So these are ways that he might sustain the changes that he is receiving through Walks and Words outcomes. So for the implementation and plan of Walks and Words, I kind of want to give a background on our staff team. So first and foremost, we would have a program director who would have a final say on the community needs assessment and program designs. This person would oversee the budget as well as train any other Walks and Words staff. And then we would need 2 community health workers, so 1 peer educator and 1 health representative. And then also an administrative assistant who would organize and manage our partnerships and overall meetings. And then, of course, any volunteers and community members that want to contribute to Walks and Words. So with that, the responsibility here would be building parks and trails. So 1 or 2 major projects per year. This number is a bit low because it is primarily going to be donation based. So we will have a bit of our budget allocated to creating these parks and trails. But what actually gets built is going to be largely dependent on community donations, which I will touch on more in just a bit. And then monthly community meetings will occur to just talk about any needs, wants, and outcomes, and then as well as an annual assessment of the success rate. In terms of raising bilingual staff incentives, so once a year, Walks and Words will give allocated funding to 3 partnered facilities, and then I'll talk more about the budget of that later. And as soon as this is implemented, Walks and Words is going to want to check in to make sure that these staff really got their pay codes and it's working for the partnered facilities. And then of course an annual assessment of the success rate will occur. To maintain cultural humility with the community engagement plan, because we're dealing with the largely Hispanic population struggling with a lot of language barriers, I would say that it's just very important to have staff educated on cultural competence and make sure that everybody is being treated with respect and we're fostering an environment that people feel comfortable and assured reaching for help. So how the Gulfton community is going to be engaging with Walk Some Words. This is going to be through monthly meetings. So this is going to give them an opportunity to contribute to program planning because they can voice their concerns as well as their wants and needs about the program. And then they're also encouraged to say they want they're specifically interested in pickleball or skate parks. They're very much encouraged to express that because the parks and other facilities that are implemented, we want Gulfton residents to utilize. So we want to give them what they're interested in using. They are also very strongly encouraged to make financial donations, especially if there is a specific facility that they're wanting. And then they're also encouraged to help maintain these facilities so they can sign up to be part of a group of people that maybe does park cleanups or other things just to help with the maintenance of the facilities that are being implemented in their area. So on this first budgeting page, you can see a price breakdown of the salary and job description of all of our Walk Some Words staff, as well as a budget specifically for construction staff who will be actually creating the parks and trails. The second half of our budgeting here shows any other resources that we might be utilizing that cost Walk Some Words, the largest being our infrastructure. So this is our budget for the actual parks and trails being built themselves. So we can allocate $50,000 a year to land, lighting, park amenities, aspect of whatever facilities that they want. This might be enough to build a small park or a tennis court, but if the community is wanting more than just that facility or more than just that park, that is where the donations primarily come in. And then as you can see, there's also $4,200 set aside for 3 different clinics partnered with a year to kind of help raise the bilingual staff. So that brings the total annual cost of this program at $352,084. Potential challenges that we may face, so insufficient donations. So this is especially going to be prominent when Walk Some Words first starts up. Not that many people are going to be involved initially. So a solution for that, we want to promote our very first project, get people involved, educate the residents on why it matters and how it benefits them. Our second challenge, limited clinical outreach. So we might be partnered with a lot of facilities, but we only have funding for 3 clinics to raise their bilingual staff pay. And then because of this, a lot of people might miss their follow-ups. There might be low motivation to attend doctor's appointments. And then the way that we can kind of try to find a solution for this is by making doctor's appointments feel very quick and easy, have excellent customer service, and provide realistic solutions to our patients that are coming in so that they don't feel overwhelmed by the information they're being given at the doctors. The overall outcome that we want to have is that people perceive easier access to care and resources, and that's how we are lowering our cholesterol levels. So success would look like more residents being physically active in the community. It would look like more people expressing that they actively seek care and resources, and we would measure this data using anonymous medical records. So that would be in terms of high cholesterol, and then self-reports would be used for more subjective measures, like how often you exercise and how you perceive your access to care. Self-report surveys is going to tell us how people perceive receiving medical care and utilizing resources. So if they still feel intimidated, we can adjust to that and try to figure out more ways to make people feel comfortable, especially with cultural humility in mind. And the cholesterol assessment levels assessment will tell us how well our program is doing on paper with actual numbers and data. Thank you for taking the time to listen to my Walk Some Words proposed solution. I have some key points on why the solution is important here, as well as a works I did that I used for all of my research throughout this project. Goodbye.